We'll now move on to our cleanup hitter, Richard Knight. Sorry for the baseball analogy. Richard is a healthcare professional and business strategist. He works as a patient engagement consultant to leverage patient input and preferences to patient care plans and the like. He's also a former hemodialysis patient who received a kidney transplant 14 years ago. He's currently the president of the American Association of Kidney Patients, which is the oldest and largest independent kidney patient organization in the United States. Richard also has a public policy background, both on the legislative side, where he worked in the U.S. House of Representatives as a liaison to the Congressional Black Caucus and worked with the Energy and Commerce and Small Business Committees. In the executive branch, he's got experience in budget and procurement policies and has worked as a federal government contractor, and for 10 years has been the co-chair of the Baltimore-Washington Corridor Chamber of Commerce annual regional government procurement fair. Prior to all of that, Richard got his BA from Hampton University and his MBA from the University of Virginia's Darden School of Business. Richard, thank you again for joining us today, and we look forward to your presentation.
Thank you very much. Let me just pull up my screen here. Okay, everyone. First of all, thank you for that kind introduction. And you're right, Todd did tee things up for me, so I'm very appreciative of that, Todd. And I think that the presenters earlier all hit on key topics that really relate to some of the things I'm going to talk about here. But I'm going to speak primarily to the patients because this is more or less a call to action. So I will go over a little bit of our background and how you can work with us, and we can work with you, share some information, and come up with hopefully some remedies that will address some of the issues that we're facing today. This is a picture, by the way, not of our annual patient meeting this year, but 2019, last time we were able to get together. And of course, we know what happened after COVID occurred earlier this year. So by way of background, hit a few background items. COVID-19 creates what we call FUD, fear, uncertainty, and doubt. And we'll talk about the impact on, several people have mentioned the impact on people of color, Hispanic, Latinx, African Americans, Native Americans. We'll talk about that. We'll look at some things with respect to some proposed solutions and talk about our strategy, which is a patient strategy where we want to include as many people in the kidney space as possible, and then talk about some of our allies, some of the people that we work with. By way of background, many of you may know that we launched our organization up in New York, up in Queens, back in 1969. 1972, the founders and allies pushed Congress through bipartisan advocacy to really get the President Nixon at the time, to sign the legislation, specifically the Social Security Act, whereby Medicare covered the cost for dialysis. And today, the end-stage renal disease program is administered, of course, by CMS, and it remains the only disease-specific U.S. entitlement program that we have. And looking at our purpose, what is it that AAKP does? Well, we educate patients, caregivers, CKD, ESRD on a variety of areas, including nutrition, kidney therapies, including dialysis, PD, hemo, you name it. And we advocate. We spend a lot of time on Capitol Hill talking and working with legislators and other players. And then the other thing that we've added to our mission more recently is defining patient engagement. Patient engagement is something that patients need to become involved in, that really allows us to be to participate more in things that have an impact on our lives. And we'll talk a little bit more about that a little bit later. Principles, strategic principles. And I mention these because we're fairly consistent. We don't change over time. And the way many people will ask me, where do we stand on a certain piece of legislation? I'll talk to them about our principles, and that can give them some insights. For example, we're going to elevate the patient's voice in national issues. We're going to protect the unique relationship between patients and the doctors. So just say a piece of legislation comes out and it's going to interfere with that relationship, well, we're not going to support it. Educate. We want to educate the patients and preserve their access to choices as informed consumers. We maintain full independence on national policies. We do not surrender our letterhead. We work with many people, but we remain independent. And we honor the principle of no surprises. We work with our trusted allies, industry, government agencies, other associations. We're very upfront. We don't agree with everyone on everything. And if we have an issue, we can talk about that. So we consider that to be very important because we don't want to surprise people. I mentioned fear, uncertainty, and doubt. Well, that is what COVID-19 does. And these are some examples of exactly how that manifests itself. We don't know how long will this last. There's a certain amount of fear. We worry. What's going on? How's this going to impact me? I'm in a dialysis facility. What does that mean? Will I catch something? If you're doing home dialysis, you could be suffering from loneliness and boredom. This has impact on sleeping and eating, your sleeping and eating habits. And one of the things that is not talked about very often is the impact that it has on your mental health. We think that that is something that certainly needs to be acknowledged and expressed. And unfortunately, some people succumb to substance abuse, anxiety, and as I like to explain to people, depression. Most people on dialysis are depressed, but we like to focus on the positive side. So that frustration, intolerance, and anger, those are things that we need to begin to acknowledge and recognize. And moving on, let's acknowledge how you feel. The worst thing you want to do is keep that bottled up. Are you anxious? Are you stressed? I'll be honest with you, when I was on dialysis, I didn't talk with people about this. I would have been much better off if I did talk to someone about some of these issues. Are you simply overwhelmed? You have a lot to do. And all of a sudden, we run into COVID-19, which adds another level of all of these things that I just discussed. Are you angry, fearful? Before you can address something, you have to acknowledge it. So what I'm suggesting is that you acknowledge those feelings, and there's no shame in that. The problem is when you hold them in. So I want people to begin, particularly patients, feel comfortable and find someone, your caregiver or partner, a friend, that you can talk to about these issues. Next, I want to take a look at the impact that COVID-19 is having, particularly on African Americans, who I believe are impacted the most by this disease. And one point I want you to keep in mind: African Americans represent 13% of the population, but 32% of the people that are on dialysis. That's a significant number right there. So first, let's take a look by states. This chart takes a look at the top 10 states. This is dated a little bit, but still it illustrates the point that I want to make. Gray represents the percentage of the population of the state that African Americans represent. The red bars represent the percentage of the COVID cases in the state that African Americans have. So we can see in the state of Mississippi, 39% of the population, 55% of the COVID cases. And where I live in the great state of Maryland, 31% of the population, 47% of the COVID cases, and so on. In New York, let me see, in New York City, 22%, Blacks represent 22% of the state population and 29% of all COVID deaths. I use a little bit different parameter there as opposed to cases. For the state of New York, not including New York City, those numbers are 9% of the state population and 16% of the overall deaths there. So you can see that New York is like the other states where African Americans represent disproportionate numbers. If we look at it on a county by county basis and focus on the area in the red that sums up the slide, compared to majority white counties, counties that are majority Black have 3 times the rate of infections and 6 times the rate of deaths. I live in Prince George's County, Maryland, 61% African American population. There are 24 counties in the state of Maryland, and Prince George's County has over 27% of the COVID cases. And of course, a significant number of that impacts African Americans, and we have a fairly high rate of chronic kidney disease in Prince George's County as well. Now, if we look at it from another perspective, because we always talk about, well, we need to social distance. Again, looking at some statistics, African Americans, 12% of the workforce, but they represent 25% of the workers who are food and courier delivery workers, 27% of postal workers, and 31% of all public and urban transport workers. Those individuals have a difficult time social distancing based on the type of job. And if we look at these last 2 areas, 31% of all home health care workers, and we know that home health care workers, when you go into the home, you're going to be near and you're going to contact other individuals. And this number, particularly for those up in New York, 28% of all nursing care facility workers. So just on the basis of that, that's fairly substantial right there. And what that essentially means is that not only do we have to, as dialysis patients, not only are we concerned about dealing with our disease, the normal anxiety that comes from that, enter COVID, and if you happen to be African American and others of color, that's going to be an added level of stress that you're simply going to have to deal with. Now, I talk about some solutions, and I want to spend some time talking about education, some resources that we make available, because we happen to believe that the better educated you are, the better off you are. And that can help you deal with some of the fear and some of the anxiety that you may have. And we also believe that the thirst for clear factual information from trusted sources, that cannot be overestimated. So a lot of the information that we have, so we'll display here next, comes from our trusted partners. We have individuals from the various federal agencies come out, CDC, FDA, CMS, and other agencies that are dealing with this virus. So for example, we've had patient education webinars that focus specifically on COVID-19. The importance of that, we've had experts in the area, I believe, for transplants. We had the president of AST and ASTS come out and give a tremendous talk to the patients by way of a webinar. And they really laid out the information in very clear terminology, gave us the status of what was going on with respect to transplants, what you might be able to expect. And then taking care of your access, which is, of course, of major concern always, but certainly during the pandemic, maybe there's some extra things that can be done. So we had a webinar that took a look at and did a deep dive on that. And then we looked upstream, fighting COVID-19 upstream. What is it that the early disease patients, the early stage patients need to know? And then, of course, telemedicine, which we believe is here to stay. That is technology that we've been pushing for a long time. And we, quite frankly, many of the things we're talking about, patients have sought after for a long time. I'm glad to see the industry finally catching up with us. VA, a number of veterans, we have a Veterans Health Initiative, and we wanted to spotlight what is it that the VA is doing with respect to COVID-19 patients. We think it's very important that this particular set of dialysis or CKD patients be taken care of. So we were able to have a tremendous informational session for them. And as I mentioned earlier, mental health management, we received a lot of attention on that one. All our webinars remain posted on our website, so you can go and look at any one of them at any time. We have a YouTube page. If you go to the website, it will direct you there. But the mental health management during COVID was a very, very good session. We had a social worker who's been very much involved in working with patients in terms of dealing with mental health. And again, nutrition, which is always important. We really talk about a lot of things that you need to do to keep yourself healthy. And one of the things that we've always focused on as an organization is slowing progression of the disease. And many times when we're not aware of eating potatoes with too much potassium or orange juice or tomatoes or some of the other things that aren't good for us, we need to do what we can. And understanding from a nutritional perspective, the best things that are suited for your body during this time period, very important. So we enjoy doing those. I mentioned patient engagement. This is a little bit more expansive definition of it, where we talk about the meaningful involvement of patient, caregivers, clinicians, and other healthcare stakeholders throughout the entire research process, from planning the study to conducting the study and disseminating study information. In this context, I'm going to focus on what we can do as patients by being engaged to help increase the number of CKD patients, minority patients that are involved in some of these clinical trials. There are some challenges. I want to acknowledge those, but we don't let challenges get in the way. It's a barrier. We have to go forward. We have to go through it. I've talked with a number of companies. Well, it's very expensive. Well, you know, patients are intimidated. They have low literacy rates. Right now, the KPMP, the Kidney Precision Medicine Project meeting is going on. And I'm chair of the Community Engagement Committee. And one of the things that we do, all the patients are educated. We spend a lot of time learning the science behind it. No, we're not professionals, but we have a pretty good idea because they take the time to educate us. So that helps with, and by the way, there are many scientists because of the number of variety of areas that there are on this project. There are a number of scientists that need to be educated in many of the other areas that are outside their areas of expertise as well. So again, that is something that we have to encourage those who are doing the research to do. So if we talk about patient engagement in COVID-19 clinical trials, if we're going to grade it, we're going to have to give it an F. You know, right now we're hovering somewhere close to 200,000 deaths. And as we mentioned earlier several times, that Blacks, Hispanics, Native Americans, they represent a disproportionately high number of people who are dying from this disease. But with respect to those who are participating in clinical trials, the numbers are very low. Now we know that there's an issue of trust. These are some of the things that we propose. I did a presentation and talked with some people from the private sector about ways that they might be able to offset the lack of trust. First and foremost, you know, you can't wait until you need something to go out and go after it. That's why we suggest working, if you're within a community, why not establish some community advisory boards? Why not begin to reach out to your organizations? And depending upon the makeup of the community, if you're in a Hispanic community, then you go to some of the Hispanic organizations. If you're an African-American community, you do the same. And if you're in another part of the country that has Native Americans, then that is what you want to see, to engage them before you have an emergency. And you don't just want them to be the patients that are going to be involved in the, to just be patients. You want to have some of those patients involved in the data safety monitoring board, the external evaluation panel. You know, we happen to be patients, but many patients also have professional careers. And I have several patients, matter of fact, who are doctors, medical physicians, surgeons, etc. And they're always happy to help. Focus on patient-centered outcomes. Many times these projects get going, and I'm always the one in the room saying, are we going to talk about some patient-centered outcomes? Clarify the research costs. I've got an accounting background and always reference full costing. If it costs money for you to include and engage patients, then this should be part of your budget. It's not costing too much. If you happen to be in delivery service, you don't say, well, you know, we really can't afford gas. Well, if you're in the delivery service, gas is an integral part of what you're doing. If you're in the research field, and let's be clear about this. I am not one of those that says that out of the goodness of your heart, you should include minorities, you should include CKD patients. What we're talking about, if you develop a vaccine and that vaccine has not been properly tested on all of the population, then when that vaccine becomes available, we may have a disaster on our hands if it has an adverse impact because you have not tested a sufficient number of all the people that exist in the country. Then what do? And then what happens to the level of trust? We have to make a better effort. And I will say this, that NIDDK, the National Institute for Diabetes, Digestive, and Kidney Diseases, which is responsible for putting out some of these contracts, they're in the process of revising a strategic plan. And I have to be working with them on that. And in terms of stakeholder engagement, that is becoming an integral part of their strategic plan. With respect to all stakeholders should be involved. Stakeholders should be genuinely engaged across the research continuum. They should be diverse and representative of the community. And they should be involved in a very realistic fashion. And they must be trained and educated. Now, will that cost some additional time? Yes, it will. But the reality is that in the long term, it's going to be much more efficient because it will help attack some of these areas of disparity that we have and that the other speakers have gone over so eloquently. Increased use of telehealth. Why does a patient have to go into your facility just for you to talk to them and get an update? That certainly can be done via means of telehealth. And again, I'm going to emphasize, we have to mitigate the potential harms by clarification of patient engagement and decrease the mistrust and increase the trust that we have. These are just some ideas as to how we might do it. Over the last 7 months, again, our tool is education. And what we want to do is provide a means of education. And we've done some things on a virtual level that we've been doing that for quite a while. And this past 7 months, we've done our global summit, a policy summit. We talked about several of the policy issues that we talked about before, that were mentioned before. Medicare Advantage, for example, 2021 is going to be a very big issue that we're taking a deep dive in now. If anyone has Medicare, you know how difficult it can be. In a Medicare Advantage, that's another level of complexity. We're worried about patients being sold things that are inappropriate for them. And we just had our 45th annual national patient meeting, which was just last week on a virtual platform. That is still up, by the way, as well. And many of the things that Todd talked about in particular, artificial implantable kidney, wearable dialysis machine, a number of the innovations were discussed there. That information is available for you to view at any time. And of course, I want to mention again the COVID-19 issues that we covered. And we focused on research and clinical trials, strategies for addressing the disparities, and always innovations, kidney drugs, biologics, and devices. We try very hard to make certain that we reach out to the patient community. And we actually have gone global. At our global summit, we were in touch with as many as 70 countries. And for those last 3 venues that we did, we had over 75 global and national experts. So many of the members of ASN and the other organizations are kind enough to come out and share their expertise with us and talk about a number of topics. We've had 40 American global patients, 10 webinars in our COVID-19 Healthline series, and prior to or not including the national patient meeting, the audience reach had exceeded 50,000. And we continue to share our content. It's all free. We don't charge for that. Again, our objective is to educate the patients. We want you to become your own advocate. And the worst thing that any of us can do, and I've been through it, so I understand if you're there, is to sit back, be depressed, and not feel that you're in control or that you can do anything. Trust me, with some of the new innovations that they have coming out there, it's making a quality of life. And at the end of the day, When the doctors come in and talk about your biometrics, your KT over V, your BUN, and all the other metrics, the real question I always say, ask them how they feel. A qualitative issue. Ask them if they can play with their grandkid. Ask them if they can walk up and down the steps, flight of stairs. That's what patients are interested in being able to do, is have that quality of life. When I tell you that we don't work alone, we don't work alone. Part of our strategy is to work with as many organizations, we call them strategic allies and partners. On the top row, you'll see ANA and ASN a little bit to the right. And then in the first section below, on the second line, you'll see Rogosin. And of course, we work with a number of government agencies. We strategically join a number of their task force so that they can have a patient voice. In the last 18 months, we've worked with over 70 companies in the private sector, doing surveys, giving them feedback on something that they might be doing. And surprisingly, and we certainly appreciate and support KidneyX, surprisingly, you've got a number of new technology, new innovations coming in the field from non-medical people. A lot of engineers are coming with some very interesting ideas and concepts. Again, from a policy perspective, early on in Secretary Azar's time here, myself and Paul Conway, the former past president, was able to spend some time with him and talk about, I think this time we were talking about drug prices. And Adam Bowler's over there to the right, who used to be head of CMMI, he's no longer there. We had an opportunity to sit down and talk with him. I'm showing you this picture here because this was taken during the previous administration. And ASN was a key player in this. I mean, they played a significant role here in the commitment to help with organ summit at the organ summit and organ donation, particularly kidneys. And I mention this because it doesn't matter which party is in office. We're going to work on behalf of the patients. Our earlier speaker, the good doctor, talked about leadership. I teach a leadership course. And one of the things that I do when I explain leadership to the students, I point to these individuals in elected positions to say, this is an example of not leadership. When you're in a leadership role, this is not how you act. And I stand by that, because if they were doing it for their constituents, their behavior would be different. We're interested in doing whatever we can for the patients. It does not matter who's in office. We're going to work with anyone. So you'll always hear us refer to ourselves as bipartisan and nonpartisan. Proud of this picture here. It's two brothers from Atlanta. And the one that's in the middle donated his kidney to the one that's on the right. And they had the good pleasure of visiting and coming up to the White House Summit on organ donation. And, you couldn't meet two more positive guys. It really just warmed my heart to see that. And I think that patients have the power to drive change. We have to get educated. We have to get engaged to do that. Again, just some information about our patient meeting that just happened last week. And it's actually still up. It's up on a platform that we engage. If you go to waakp.org, it'll take you right there. And we're very active on social media. So if anyone wants to engage us, we're out there. Just spreading the word, trying to educate people. And these are our vehicles that we use to do it, our various handles. And I want to thank you very much. And thank you, Todd, for giving that overview of Decade of the Kidney. So I don't have to go into it here. But that is something that we are strongly behind. It's an idea that relates to the Decade of the Kidney. So between 2020 and 2030, we believe that some very positive things are going to happen. And we're going to do what we can do to make them happen. My contact information there, if anyone wants to get in touch with me, feel free. And I want to share this information with you. And I will turn it back over to the moderator.
Thanks very much, Richard. That was a great presentation. I appreciate your insights. I just want to make a couple comments. The first of which is, as you point out, I think one of our key failings in nephrology, and particularly in dialysis, is a failure to align our quality goals. As you pointed out, the most important goal for a patient is feeling well. And dialysis providers are graded based on things like KT/Vs and hypercalcemia, as you touched on. So we need to better align those quality goals so we're all pulling in the same direction. The second thing I would reflect on is your comments regarding patient engagement. And I think that's going to be especially critical, as you pointed out, as vaccine trials continue, and particularly for patients with kidney disease. I know there's at least one of the vaccine trials that's excluding patients with kidney transplants, and clearly it's critically important to understand how the vaccines work in that population. And similarly, as we head into the fall flu season and hopefully have COVID vaccines available sometime in 2021, we need to make sure patients are engaged and get those vaccines to protect themselves.